Okay, so it's exactly 12 o'clock, so we're gonna go ahead and get started. So thank you everyone for joining us today. Um, we're happy to have you here for our Connect, Empower, Prevent IVP webinar series. And my name is Ciara Scott, and I'm a project manager here at the UNC Injury Prevention Research Center, and I'll be moderating today's webinar. The purpose of this webinar series is just to provide a platform for sharing innovative and impactful research, initiatives, techniques, and strategies to generate discussion and foster connection that will inform and empower injury and violence prevention research and initiatives. And this webinar series is just one of several educational events hosted by the IPRC. And the webinars in this series are hosted on the second Wednesday of each month from 12 to 12:30 p.m. And each month we feature a different speaker who presents on research or initiatives relevant to an IVP topic area. And this is the second round of this series. We're kicking it off today, and it's going to run from now through May of 2024. So you can catch us here every month at the same time. And this link down here on the screen will take you directly to our page on our website for the webinar series, where you can find the most updated schedule and more information about the series. And so before we get started today, I just have a couple housekeeping updates. So we will be having time immediately following the presentation for Q&A. And so throughout the presentation, you all can feel free to drop questions into the chat as they come to mind. I'll be monitoring the chat and collecting questions so that when we do get to the Q&A, I can pass those to the speaker. And the presentation today is being recorded, and it's going to be made available on our YouTube page. And so because of that, I've currently disabled video and mic for all audience members just to protect the quality of our recording. And so if you're wondering why you can't unmute, that's why. But when we get to the Q&A portion, I will enable the mic for those who want to ask their questions directly to the speaker for today. So I'm going to pass it to our director at the Injury Prevention Research Center, Dr. Steve Marshall, who is going to tell you a little bit about our center and then introduce you to our speaker for today.
Thanks, Ciara. Really appreciate all the hard work that goes into preparing for the seminar series. Webinar series. And also want to acknowledge our Associate Director, Beth Morocco, who's joining us today, who's Beth and I have worked in the center for a long, long time since we were graduate students. Actually, officially, it's not that long. It just has seemed like a while. And we were delighted when to first meet Nidhi through Orange County Health Department, through a UNC employee, as an employee of the State Health Department. And now there was another foray into another campus that will remain nameless. And now we're really excited to be working with Nidhi in the capacity of strategic initiatives for the North Carolina Association of County Commissioners. So Nidhi needs no introduction, but just to say that the concept of having strong capacity in local government and in local areas is a key part of IPRC's mission. I think we've advanced the slide. So I'll hand back to Ciara.
You can keep going.
The mission of the IPRC is to advance broadly injury and violence prevention. And we do work in a couple of different areas, as you can see from the middle column, with gender-based violence, opioid disorders and overdose, child maltreatment, TBI and road traffic injury. Some people sometimes don't see how those are connected, but strong local communities that are informed and have the ability to launch programs at the local level that address the intersectionality of those problems is really what IPRC is all about. So sorry about the miscue there. I'll hand back to Ciara.
Thanks, Steve. So just really quickly, I'll just give everybody a more detailed bio of Nidhi. So Nidhi Sachdeva is a thoughtful leader and passionate public health professional committed to creating healthy, safe, and equitable communities. She is a systems thinker with hopes of creating a culture of curiosity and care. And Ms. Sachdeva serves as the Director of Strategic Health and Opioid Initiatives with the North Carolina Association of County Commissioners, where she assists counties in planning for and utilizing national opioid settlement funds, implementing and evaluating health initiatives, and maximizing resources and impact through technical assistance, outreach, education, and collaboration. She has worked in public health and harm reduction in various capacities on multiple levels within government and research universities. And I'm really excited to have her with us today. And she's going to be presenting on connecting with local governments and empowering communities to prevent drug overdose. So with that, Nidhi, I'm going to pass it to you.
Thanks for the warm introduction, Sarah and Steve, and Beth for having me here today. It is wonderful to see familiar and new faces in the audience. I am delighted to be here with you all. I'm going without slides, which makes me feel a bit naked. So I'm hoping that this can be a bit more conversational than maybe some other webinars y'all have been in lately. But just want to tell you a little bit about what I'm about and what we've been up to lately these days. But like introduction, thank you so much again, Sierra, for reading my bio, but it always feels weird to have it read out loud. But yeah, I'm Nidhi Sachdeva, and I've been doing this work for a long time. And although I'm new to the association, I've only been here for about a year. I've been doing overdose prevention work in North Carolina for about 15, 20 years. And like Steve said, working in injury and violence prevention, you can't help but notice the commonalities, right? The root causes to a lot of the different injury and violence prevention topics. And I'm really intentional about wanting to create, again, cultures of community and care, and understanding that we've all just got to take care of each other. At the root cause of this, there's a lot of pain that communities are feeling. A lot of people are having hard times. And so we've just got to do a little bit better at sort of taking care of each other and taking care of ourselves. So I'm hoping that you all are in a place today where you can do a little bit of that. But yeah, so I am going to talk a little bit about sort of what the national opioid settlements are and what they look like in North Carolina. And I'm really eager to get to the Q&A part. So hope y'all are, thinking of some good questions and some discussion. We've got a lot of great experts in the room. It's not just me and others, but folks I get to work with every day, which is really great. And so I'll talk a little bit about the settlements, kind of what local governments are up to these days with the money, and just some encouragement of how you might be able to interact with the process and engage. And so I work for the North Carolina Association of County Commissioners. We represent all 100 counties in North Carolina. And we have been a part of the national opioid settlement conversations for a while now, but we work really closely with the North Carolina Department of Justice and other partners all over the state to basically come to an agreement, right? Our Attorney General, Josh Stein, was the leader of all the attorneys generals in the coalition to try to navigate and negotiate the national opioid settlements, which is basically a collection of thousands of settlements, really, all across the country to try to hold drug distributors, drug manufacturers, pharmaceutical companies, pharmacies, distributors, whatever, accountable to their role in the opioid overdose crisis, right? So this is not the first opioid overdose crisis we've ever had in our American history. It certainly is the deadliest. We're currently in the third or soon to be fourth wave of it. So it started off with pharmaceutical medications, overprescribing, mismanagement of pain. And unfortunately, as our systems of care have failed patients, we sort of transitioned into different phases of the epidemic where heroin became more popular, more easily accessible, cheaper to get. And then the introduction of synthetic opioids like fentanyl. And now we're getting into sort of a big old mess with new introductions of xylazine and some other contaminants in our drug supply. This is, of course, a result of a historically racialized and over criminalization of drug use and bad policy. And so here we are in a spot where we're trying to get ourselves out of this mess. And yeah, so 11 people die every single day in North Carolina. That's 11 people today, that's 11 people tomorrow. It's 11 of our friends, our loved ones, our family members. And that breaks my heart every single day to say it whenever I do. But I've got to really start with that and just remember that These are people that we know. At this point, all of us could probably say that we know somebody or know someone who loves someone who's died of an opioid overdose or at least is affected by it. And so we've got to really center people with lived experience, the grief that we all share, and work towards community healing. And so the settlements are a big amount of money. It's a meaningful amount of money for sure, but it's not going to be everything. It's not going to be the solution that gets us out of the sort of failed systems of care for people who use drugs. But it certainly is a start, and it's been a wonderful way for us to really rally around the topic and sort of find new energy to focus in on our priorities and figure out what we want to do together to make our communities a little bit safer and much healthier. And so in North Carolina, of the $56+ billion that are coming through the national settlement, North Carolina is getting about $1.5 billion, which is a good amount of money. It's going to be divided up between all 100 counties and 17 of our largest municipalities, and over the course of 18 years, which is interesting and different, right? So most of the time for folks who work in grant world, we've got 1, 3, 5-year grants. So we get really excited. We're like, oh my goodness, 5 years. We can like plan and actually evaluate. But in this case, we've got 18 years. We're in the second year, third year now. And so we've got some time to plan and do hopefully find a good balance between preventing the crisis of losing 11 people every single day and investing in our systems of care for later so the conversation can be different in 5, 10, 15, 18 years, right? And so we're trying to find a balance between investing in sort of crisis management and response and then working in sort of the different levels of the social ecological model for folks in the room that might be familiar with that. But the role of county government is really interesting. So North Carolina has set up their opioid settlement where 85% of that $1.5 billion is going directly to local governments. 15% of it goes to the state, 85% of it to our local governments, the 100 counties and the 17 municipalities that I mentioned to you. And that's unlike most other states. They're, 50-50 split or putting it in a big old trust and creating a lot of bureaucratic barriers. But we were saying in North Carolina that one, our communities feel this epidemic the hardest. Our communities and our state are very diverse. It's big. We're the 9th largest state in the country, which means that the way that communities experience the overdose crisis looks very different depending on where you are. And so that means that our response also must look different, right? And so in order for us to get money directly to the communities as quickly as possible, given the urgency and the need to tailor the response to whatever the local needs are, as well as taking into consideration other strengths and resources that each community might have, we were like, you know what, we're not going to waste time. We're just going to get money out to the communities, which is an amazing opportunity for us to get the funds as closest to the people that are impacted. And so I just want to sort of take a step back and also say that every single one of us live in a county in North Carolina, right? We might not all live in cities, but we all live in counties. And so there are representatives who are meant to have your best interest in mind and represent your needs. And so I'm very much encouraging you all to sort of engage in the process, make sure you vote in elections, and like just pay attention, right? Because all of this is going to affect you as well. And so county governments are also, they tend to be the local government level that implements and delivers more health and human services than say cities might. And so that's another reason why counties are really in a pivotal spot to really invest this money wisely, respond to the needs of the community and build up those systems of care that they often deliver themselves. So EMS services or health department services and other, public works and public safety and all that sort of falls under county government. So there's a lot of different departments within county government that feel the effects of this and are in a position to respond, which is really wonderful. And so with the North Carolina Association of County Commissioners, since we serve all 100 counties, we're very much here to support them. And so I lead the Opioid Settlement Technical Assistance Team in very close partnership with our friends over at UNC's Injury Prevention Research Center, as well as our DOJ partners, Department of Justice and DHHS, to basically help support our local governments in investing these dollars in evidence-based harm reduction strategies that are high impact and have promised to, again, find that balance between protecting lives, saving lives, investing in our systems of care. And so in North Carolina, we are governed under the Memorandum of Agreement, which basically tells local governments kind of what's what, like what they're able to do with the money, where they need to keep it, how they need to report on it, keep accountable to the eligibility requirements of the funds. We're learning from lessons of the past. This is the second largest settlement in our history. The tobacco settlements was the biggest one. And so, we want to make sure that all the dollars are invested in interventions and programs that are really focused on saving lives from opioid overdose, and just doing good work, essentially. And so with the opioid settlement technical assistance team that I lead, we basically help translate a lot of the legal requirements of the MOA, help build infrastructure around sort of reporting and accountability, coach counties and local governments in how they can spend the money, program services, projects, do a lot of like connecting. We've got a lot of really great work in North Carolina that's been happening over the last 15, 20 years. So like this is not a new topic to any of our communities, but again, the settlement is a new opportunity. And so that comes with, some parameters and guidance and guidelines that we want to make sure everyone understands. One of the key features of the opioid settlements requirements is that all local governments have to do an annual meeting every year that's open to the public. So this is another sort of call to action for you all to sort of pay attention and participate. If you're interested in the topic, if you have area of expertise or specialty, please come and share what you see and hear and feel, and what your ideas are, because our local electeds really want to do the right thing. They just need to learn with you all and with us about kind of what's right for the specific community that they serve. And so, yeah, I think the other plug that I would feel remiss if I didn't say out loud is also just to get naloxone. Naloxone is a drug, a prescription medication. Now it's over the counter, which is pretty great. That can save lives from an opioid overdose, and you can get it at any pharmacy in North Carolina, as well as through our health departments and community-based organizations. But knowing the signs and symptoms of an overdose and how to respond with naloxone could really save a life. And it's honestly more likely that you'll probably come across an overdose in some scenarios than someone having a heart attack or something, even though we have AEDs everywhere. So yeah, I'm really open to questions and your ideas and thoughts, but local governments are in a position again where they're closest to the people that are hardest impacted. And so they're really positioned to help out. And we're hoping and encouraging local governments to really listen to communities of people with lived experience. Oftentimes people who are living it will be able to flag concerns before our data will tell us, through epi data and whatnot. And so it's really important for us to listen to the folks that know best where our systems are failing them and what are potential solutions to those challenges. But yeah, I don't know, there's a lot in my head. I do this all day, every day, and I love it. And so I can take the conversation in any direction you take me. But I welcome conversations and questions, and I'm going to put a bunch of resources in the chat real quick, just for you all to take a look at your leisure. But what's included is our main sort of website, the opioid settlement. Sorry, I think I skipped that word. I'll make sure that those all work, but the first one should be different. Anyway, I'll fix it. ncopioidsettlement.org, which is our sort of all things opioid settlement, where you can peruse all things like what's required, what's eligible, lots of resources, good connections. I'm also going to put our NCACC website up there, just in case you want to stay in touch after this. The North Carolina Department of Justice MOA Resource Center is a really great resource for some sort of what's going on with the national settlements, especially as some of them are still rolling in. So you can get a read on that. And I'll also include a link to the Opioid Substance Use Action Plan dashboard, which has all data on the DHHS houses around this work. So I'm going to pause and just get these links right, and then send them to you on the chat while we pull together some questions. But thank you for having me. It's lovely to be here with you and to get to do this work every day.
Thank you so much, Nidhi. So we are going to move now into the question and answer portion of the webinar. So I didn't see any questions in the chat, but if you do have questions, you can feel free to drop them in the chat, or you can use the raise hand function, and I will call on people to ask their questions. And so I'm just going to give it a moment to see if anybody puts questions in the chat or raises their hand. But while we wait, one question that comes to mind, Nidhi, is maybe are there any examples you could think of and are able to share about any challenges counties have had with trying to decide how to utilize their settlement funds and how you've supported them from your office?
Yeah, sure. I mean, these are really big, challenging problems, right? And so no one simple solution is really going to get us out of it. So I think the biggest question that local governments are wrestling with is we want to do all of it, but we can't necessarily afford to, or we can't do it all at once. So where do we start? And in North Carolina, we have, as part of the MOA, a list of sort of exhibits that are included that include all the strategies that are eligible with the fund. So there's Exhibit A, which is a list of like high impact evidence-based strategies that are like, go forth and do these. We know this stuff works. We've got great examples. Don't waste time, just do it. And then we've got option B, which is Exhibit B, which is a longer list of strategies that are a little bit further away from the people that are highest risk of death, and investing in sort of the ripple effects that come with that. And so local governments are deciding whether or not they want to take which approach. Most are choosing to go A. There's plenty to do in that list for sure. And it has a really interesting balance of like crisis response and medication intervention, focusing on some root causes and social determinants of health, like housing, employment, and recovery support, and sort of social connectedness, and focusing on the like actual emergency naloxone certain service programs, disease prevention, and post-overdose, and then focusing in on populations that are at highest risk of overdose, which include folks involved in the legal system. So in North Carolina, really good research has come out of the UNC Injury Prevention Research Center that lets us know that people who are involved in the legal system are 50 times more likely to die in the first 2 weeks of being released, which is really not okay. And so how do we do our best to keep those folks safe, knowing that they're dealing with like lots of different challenges sort of layered on top of each other? And so probably the challenges to that end is which of those strategies do we start with, knowing that they're all important, and they could all be a big help in our communities, and how do we build on sort of work that's been successful in the past, as well as fill in gaps that we know already exist. So building capacity, maintaining our workforce, making sure that we're listening to the people with lived experience in our community so that our programs can be of high quality and best responsive to their needs. And it's hard. I mean, there's no simple answer here. But like I said, I think local governments really want to do the right thing. They just need to figure out what that is and where to start first.
Thanks, Nidhi. And we now have a ton of questions in the chat. The first one, I think we've kind of touched on it. I'll still read it, and if there's anything you want to add. But Catherine is asking what has been the biggest challenge in working directly with local governments for the settlement?
Great question, Catherine. I think one of the challenges is that the settlement is only one piece of many services that counties and local governments offer, right? I mean, they're the ones that, help you pick up your trash and take care of your kids at school, and make sure that you've got clean water and restaurants that are safe to eat at, and like all of the things that local governments do. This is only one piece of it. And so in these initial stages, we've really been trying to build up sort of a workforce of folks that are paying attention to this topic, and kind of support them as they navigate the complexities and nuances of the settlement, which again, old topic, but new opportunity with the money. But yeah, I love, honestly, people who work in counties are good people, and they care about their communities. They want to do right by the people and their neighbors. And it's been honestly a total pleasure. Like I'd like to say that in my career, I've sort of wiggled and swerved through lots of different ways and worked in local government, state government, research universities, but I left my heart in the community a long time ago. And I'm really happy to be back working in the local scene. So it's been a lot of fun.
Another question that we have is, what are some ways to address stigma?
And we went to this big one next, huh? This is a good question. I welcome everyone else's input because this is hard to do. I think in quick response, even though this again is a much bigger question, I think a couple different ways in no particular order, but just the way that they're coming to my mind is trusting people who live experience and finding the humanity in our shared experience of suffering and the very natural need to find relief and pleasure in our human existence. And just listening to stories and understanding with an empathetic ear that we're all just trying our best. Using compassionate language is probably a way to address stigma as well, and acknowledging that again, we all love people who use drugs, so why should we other them and create barriers to accessing care, really? And yeah, so again, this is a big question. I'd happily like talk with y'all about this one some more, but that's probably where I'll start today.
Thanks, Nidhi. And if others have thoughts about that question, feel free to also continue the conversation in the chat. But the next question that we have, how many counties in North Carolina are already spending their funds versus how many have not spent any of their funds yet?
Yeah, great question. So one, to sort of level set, North Carolina local governments are not required to spend the money that they receive in the same year that they get it. The money is being front loaded, so depending on who the defendant is in the settlement, they're paying out on different timelines. And so a lot of counties are actually saying, because we know we have a long-term trajectory here, we want to make sure that we sustain good work over time. And so they're sort of spreading out the dollars over the 18 years. And so and we also want them to be really intentional about how they're spending and investing the dollars. And so, like, in my mind, it's okay that they're not rushing into decisions and that they really want to understand what the settlement is about, what they're allowed to do, what works, what their community needs, listening to people who live experience so they can get a better sense of, where they could be the most helpful. And so the timeline will vary depending on where counties are. The settlement is also one funding source of many. So like there's still federal dollars coming in, there's still state money, there's still private philanthropy. And so in some cases, some local governments, again, have been doing this work for a long time and they're needing to sort of spend down other grants or whatever first before they get to the settlement money, because there isn't sort of that end expiration date as there could be with the grant. And so we have about 38 local governments so far that have already sort of publicly declared how they're spending their settlement dollars. The UNC Injury Prevention Research Center team has put in a really great sort of built a really great local spending plan dashboard. So you can take a look at the link that I just put in the chat and see how local governments are spending their dollars, because they are required through the MOA to say out loud again ahead of time kind of what they're planning on investing money into. And so there are many more counties though that are in the planning process. So they may not necessarily have like budgeted dollars yet, but they're still in the strategic planning process or trying to figure out what their next plan is. And so they might not have spent the money yet, but they've got plans to. Does that speak to the question?
It sounded like it did. And I think the next question kind of builds on that. And so I'm going to ask it if you have anything else to add, but do you have a sense of what is the discussion around using funds for immediate needs versus future investment, such as in housing or other social determinants of health?
Yeah, great question. I think it's mixed, as it should be, right? Like I mentioned, 11 people are dying every single day. And so there is an urgency that we need to stop that. And also understand that, like, I mean, in my mind at least, drug use is a symptom of much deeper societal ills. And so how can we do our best to also invest in those social determinants of health? Like, is it really a drug use problem, or is it actually a poverty, inequity, racism, systemic challenge problem that people are just trying to find relief from? And so I think housing is certainly a topic that is on the minds of all local governments. They know that. And so I think that is a popular strategy that they're exploring, knowing that certain populations might be feeling the pinch a little bit harder than others. But we need to do both. So I might go straight into Alex's question next, if that's all right. So what type of upstream strategies are counties exploring and implementing? There's a couple of different things. Again, housing and employment access is one sort of upstream strategy. There's also a focus on early intervention. So this idea of knowing that there's sort of intergenerational effects of drug use. How do we do our best to support kids that might be experiencing trauma? And so how do we prepare the adults around children to best support kids, knowing that most kid problems are actually adult responsibilities? And so how do we identify kids that might be in environments that are particularly challenging or like have mental health conditions that might be showing up earlier in their life as sort of a precursor to say, let's wrap you up in love and support and maybe prevent drug use in the future. Hope that spoke to Alex's question a bit. Hi, Ashley.
All right, before we go into any other questions, because we are coming up on time and we have a few more questions. And Paris, I also see your hand. If Nidhi has time to stay after, then we can continue the Q&A. But we are coming up on time, so I just want to be respectful for people who do have to hop off right at 12:30. And so I just quickly want to let you all know about our next webinar coming up on November 11th. It's going to feature Dr. Libby McClure, and she's going to be presenting on workplace segregation and fatal occupational injury rates in North Carolina. And if you go to this link there, you can register. I'll also be sending a follow-up email afterwards with that registration link. And then up here is also a QR code for our evaluation survey for the seminar series to just get some feedback from you all, and also get any recommendations about future speakers that you'd like to see. So again, I'll send a follow-up email about all of this, but thank you to everyone for joining us today. And it did look like, Nidhi, you said you are able to hang back a little bit to finish answering questions?
Yeah, for maybe about 5 minutes.
Okay, all right, sounds good. So we'll try to get through some more, and whatever we don't get through, I will be sending Nidhi's contact information, and I'll share the remaining questions with her, and she can follow up via email with folks. All right, so let's see, where did we leave off? So, okay, there's a question. I believe that a portion of settlement funds is meant to be spent on racial equity. Do you have a sense of how many counties have incorporated that into their use of the funds?
Sure. Well, sorry, let me read the question because my brain can process it better. There is an understanding that there are populations that have been harder hit by the overdose crisis. Yes. And so racial equity, in my mind, is something that is woven into many different strategies. It's not like explicitly a requirement of the settlement, but it's very much encouraged. And like I said, woven into a lot of the different strategies. So depending on like how, like for example, a requirement is that they have to do involve local stakeholders and like different representatives of different groups, including groups that work with marginalized populations. There are 3 strategies in the Exhibit A strategy list that are focused on folks who are involved in the legal system. As we know, it's a very sort of racialized response over criminalization. And so that's also an intention behind focusing on those strategies to try to mitigate some of the harmful impacts on certain marginalized groups. It's to me just sort of how I approach my work all the time. And so I try to, again, encourage it at every point. But it's not like an explicit racial equity just by itself. Like it should be sort of, I think, incorporated into all that we do. That's kind of a messy answer, but it's a messy work. So
thanks, Nidhi. So Paris, you should be able to go ahead and unmute and ask your question.
All right. Hey, can you hear me?
Yep.
Awesome. Nidhi, just want to thank you so much for speaking with us today. Really appreciate everything that you shared. So my question is kind of relating to equity. We've talked a lot about that in this conversation. I'm not familiar with how the settlement works, and my question relates to like, what is the equitable distribution of the settlement funds? So obviously there's the 100 counties. Do all the counties get roughly the same amount of money? Like if certain counties are more rural and like, depending on what the data says, like, do they get more of that money? So yeah, I'm just very curious about that.
yeah, great question. So my non-lawyerly answer, since I'm not a lawyer, is that there was a bunch of very smart lawyers who got together to come up with the formula at the national level. And so essentially, I think they considered 3 different factors, one being population, one being overdose death rates or numbers, and one being the number of prescription medications and opioids that were prescribed and then dispensed in that area. And so, no, not every county is getting the same amount of money. Like the Mecklenburg and the Charlottes are getting much more than some of our smaller rural counties, just again, given the population base. And the deaths, but it also sort of takes into consideration the impact of the overdose death rate. And so not every rural county is getting the same amount given kind of where they are in that curve. So I think they tried their best.
Thanks, Nidhi. So we are coming up on that 5 minutes, so I want to be respectful of your time. We have a couple of more questions in the chat and one in the Q&A, and I see there has been some discussion from other audience members, but I'll download this chat and send you these questions with names and contact information. But then also, like I mentioned to everyone, I'm gonna send out a follow-up email from this webinar. It's gonna have Nidhi's contact information. If you want to reach out to her directly to connect and continue any conversations. So thank you so much again, Nidhi, for joining us. Really appreciate it.
Thanks for having me, and thanks for all the folks in the room that are in this work with me. It's hard to do, but it's a pleasure to work with you.
Thank you so much, everybody who stuck back. Really appreciate it and hope to see you on November 11th. All right, bye, everyone.
Thank you.
Thank you.